Well, hello. My name is Michael Mulvihill. I'm the CEO of Orcas. I'm also an investor and a board member in the company, and I was brought on a little over 4 years ago to leverage my entrepreneurial expertise in helping commercialize a company that had been primarily funded by NIH for over 25 years. So the company was founded in 1989 by Dr. Dennis Airy, who is our Chief Science Officer and has overseen our clinical trials and our scientific legacy to this day. So we address the problem of the preclinical population. So it's more of a preventative, proactive type approach. And we're working especially with people who are preclinical for depression and who need help with resilience and strength building. And we're also working with couples who need to build their resilience and communication skills. And we're building out a platform to also deal with the physical well-being side of the equation as well. So the kind of settings that we're working in are very varied. We're working with large distribution partners who work with employer groups and or health plans and even provider groups. So it's a very mixed type of settings that we're working in. So we engage people often through an EAP program, an employee assistance program, or through a wellness program, or through a disease management program, through a proactive set of communications. It also can be prescribed, if you will, through physicians or case managers or health coaches. And there can be a lot of proactive outreach and screening to help people who are at risk for things like depression and hypertension and other conditions that are of great concern. So the kind of value that we're creating for our distributors are a couple of things. Number one, the scientific legacy of the company is very rich and strong, and we run randomized clinical trials on all of our interventions, which, by the way, we refer to them as mobile self-management interventions. So our distribution partners are very interested in trying to figure out what works in the mobile health space. I don't have to tell you that there's a lot of products, a lot of apps, a lot of interventions, new companies coming up all the time. But because we put everything through a clinical trial and do market analysis on it, we're helping our distribution partners figure out what actually works now and also a commitment to that in the future. So that's a big value proposition for them. The other problem that we're addressing with our distribution partners is engaging people who are really difficult to reach. So again, we're looking at the subclinical population. They're not easy to reach, and we're creating technology, mobile technology, that is very simple and easy to use and very fast and even somewhat lighthearted for difficult type problems. So we're kind of ensuring the effectiveness and the engagement through helping them reach these difficult populations.